It's not just Florida, and certainly in Athens, there have been lots of videos I've seen of the students at bars. The university, I think, did what they could to make the campus a safe environment. But, students are students. They're going to do, of course, they're going to do that. If I was them 20 years, old, I probably would too. So of course that's going to happen. I think it was a failure to anticipate, just basic human behavior and what would happen when you reopen a university in the middle, when we were a hot zone, a hot spot. A lot of imported cases came to the university. A lot of students showed up on campus with who were already infected. And of course, that spread widely on our campus. The surveillance testing for a couple of weeks in mid-September, 9% of about 1,500 students who came in who were asymptomatic were positive. And those positive students could be infecting others. That's 1 in 11. So if you scale that to the entire university, that's a lot of students. So we can't control, or I can't control the behavior of students who go down to Clayton Street and go to the bars, right? I can't control that. But I can control my own behavior and where I go and where I choose to eat or meet friends, where I shop. And if I walk into a store and I see a bunch of folks without masks, I turn around and walk out. That's my decision, my control. So I think we can take some control over our behavior and our decisions and support businesses and restaurants and establishments that are trying to do things right by us. And I think that's one decision we could also make.
Right. And if you just let me share this, I have two children, one who is a junior at Spelman and the other one who's a freshman at Kennesaw State. Completely different experiences. Spelman, private, new. We're going to take this phase by phase to see what we're going to do. They decided early in July or 1st of August that there was no way they were going to be able to bring the students back. So the Atlanta University Center did not do that. Kennesaw State was like, come on in. Okay, fine. So I looked at how the Georgia college system was reporting, and there was an article in the New York Times that you could push, and it would tell you with colleges what the reporting rate. Mm-hmm. Well, every college had some numbers except for Kennesaw State. Come to find out, they were not reporting. And I kept refreshing. I'm like, well, something's got to be wrong. Refresh. They weren't until they started to get pressure. Now they had a testing site, right? The students could go and get tests. My son's roommate, there's 5 total. One of them tested positive for COVID. He tried to hide it from the rest of the roommates. But thankfully, the outside source made him get tested on campus. And then, of course, I get the ping that I got to go now pick up my son. I did not want to pick him up. I did not want him to come home, but I knew that he had to. So I put him in the back with the groceries and I'm like, please breathe out the window. But the whole time I was thinking, this is so interesting that, of course, you want to protect a big body of students, but now I've got to bring my son and potential COVID into my house directly. It was a very scary few days. He tested negative twice. He went back to school and the roommates got together and they decided that if anybody else gets sick, they will not say a word because they did not want to go home. They did not want to disrupt what they were doing. And I thought that makes no sense, but he's 18 years old, right? And now he's an adult and he loves to say that I'm an adult. And so that's happening on one side of my family. And my daughter is, masked up and she hasn't hardly been anywhere. And everybody's raised in the same house, right? And so I say that to share the challenge of just trying to guide, even within your own family, to do quote unquote the right thing, and everybody being very independent minded and mature at different levels. It is very challenging. So to the point about the bars and hanging out, I can't blame them.
Yeah, I especially worry though about, it is true that the risk is not zero, but the risk to young people is much lower of a bad outcome than in those who are older, those who have comorbidities. But that interface where those students are in a bar, at a restaurant, there are a lot of workers in those bars and restaurants that are in high-risk groups, that are living in multi-generational homes. And it's that interface. So, if the students just met other students and stayed on campus, fine, whatever. But they're not. They're going home for Labor Day. They're going home for events. And that's what concerns me, is that risk that they're bringing into the community and the potential for that to spread into the community to more vulnerable groups.
Dr. Drake, you said you had something to add? I think that Laura and Mark bring up very good points about how individually we think about risk, and maybe one of the misconceptions about risk. So Laura gives us the hypothetical. If I can go into a restaurant without a mask, how come I can't go into a Publix without a mask? Well, in fact, in both locations, there's some risk, and those risks are independent, and so they add up. So rather than thinking about sort of the lowest common denominator, as it were, whatever is the riskiest situation that I'm willing to tolerate, well, then I'll tolerate that risk all of the time in my life, right? If I'm comfortable going to a restaurant, then I'm going to be comfortable with that level of risk throughout the day, every day. I think that is one of the ways in which we deceive ourselves, I think in this case to our great detriment. To the extent that you tolerate a risk, and I remember the first time that I met somebody in their backyard for a, well, I guess Mark would call it a physically distanced lunch, right? So we stayed on opposite sides of the patio, but to catch up after 6 weeks of being sheltered in place. It was a real relief. It was great. But does that mean that I'm going to do that every afternoon? No, I want to compensate. If I take what I consider to be a risky behavior at one point, maybe I need to double down on another occasion. My kids are in school right now. I think that's a really important thing, and I'm happy for them that they're able to do in-person school. I think that's a riskier situation than the way that our household had been living all summer. Does that mean that we raise our general level of risk tolerance to the level that that they face at school? No, it doesn't. In fact, it means that we need to double down and compensate for the additional risk that we're taking to allow them to go to school, to try and minimize the risk for the family as a whole. Now, Mark brings up the point of some different groups of people engaging in different behaviors, and Mark's right that we don't have the ability to govern the say restaurant behavior of other people, or the shopping behavior of other people, or the social behavior of other people. But collectively as a society, what we have to do is reduce risk, reduce transmission, and we can do that. There can be compensating reductions in transmission elsewhere within the same society. I take slight exception to Mark's comment, though, that in his example, it was students, but it could be any group of people. If the students want to isolate themselves, fine, go ahead and do it. I disagree with that. I think that the epidemic is something that we're all in together, and that it's impossible to have a hermetically sealed isolation group. And so another one of my metaphors is, and keeping in mind what's happening with the fires in the Western United States right now, I don't think it's a stretch. Imagine that we have something of real value, and we place it in the middle of a dry forest or a field full of fireworks, and we mow a nice little path around that thing of value that's right in the middle, and then we set the whole thing on fire. There's no way that that little path, that fire break, is going to prevent the fire from getting to what's valuable in the center. There's no way that we can isolate our at-risk people, the older people in our community, in our society, the people who suffer from comorbidities that make them increasingly vulnerable. And so I think it's important that collectively we all take what actions we can to reduce transmission.
Point taken, and I couldn't agree more. I have the flippant side of me got the best of me for a second there.
Somehow I knew that.
So we know that we've faced public health crises in the past, and we know germs such as like measles. We've faced polio. We've had the Spanish flu before any of our memories, and we know things like chickenpox that those things, Dr. Drake, you had mentioned, I think earlier it was you who said, we're not sure what the future may hold. I would curious if there's, analogs with chickenpox and such that we can talk about that speaks to how sometimes the impact, the consequences of an infection may take some time to show up. I'm not sure that that's something that's clear to everybody. Is that something you can speak to?
one thing we do know about the future is that there will be more emerging infectious diseases, some of which are likely to lead to pandemics. I think that we miss an opportunity if we don't take the chance that we have now to learn how to control emerging diseases when we're faced with them. So even now, I think we're in that learning from experience phase. Most of the diseases that you mentioned in your list are ones that we currently combat primarily using vaccines. They're diseases that are immunizing. And so once you have immunity, whether you obtain that through a vaccine or because of natural infection, you tend not to get, to get it in the future. As a result, traditionally, these diseases afflict children. And through widespread vaccines, we've been able to drive many of these almost to extinction. And I think that's a wonderful success of modern medicine. One of the problems with coronaviruses is that coronaviruses in general don't tend to provide an immunity that lasts that long. We don't know yet about SARS coronavirus 2, but very likely it will be more like something like influenza, which allows there to be infections year on year.
Dr. Abel, I think you're still muted.
Somebody had to do it, right? And there are other things that we don't know in terms of the extent to which this virus can affect other parts of the body, can cause vasculitis or inflammation in blood vessels, inflammation in heart muscle. There's a lot of controversy, a lot of uncertainty around that. We know that one of the problems in patients who get very sick with this condition is they have a high risk of blood clots, even strokes. So there are lots of other things that this virus appears to do in addition to the primary sort of lung based component of it. So we're still learning, and we have the long haul patients who have been feeling symptomatic for longer periods than just a couple of weeks. As John said earlier, we don't know enough about the long-term implications because we haven't had a long-term yet, and we're going to continue to learn.
Thank you. So let me take it a little bit in a different direction. It's been shown that quarantining and our social isolation can affect our mental health. I'm curious, are there concerns around seasonal depression in conjunction with the quarantining and the social isolation that can go along with trying to be safe from COVID-19? How is that going to affect our mental health? I'm concerned here about a rise in the rate of folks taking their own lives, recreational drug use. These things tend to increase in the shadows of disease and sharp economic downturns, which, we're seeing studies that are coming out now showing that that's disproportionately affecting folks at the bottom of the economic rung, which is often for historical reasons of systemic racism, are brown and Black people. So I'm curious, how can, number one, is that a concern that y'all share? And number two, how can we as community members support each other when we're facing that? And when it's not just due to trying to follow best practices, but also due to the economic downturns that's hitting the folks, at the, who are not at the top of the income ladder.
Ms. Shonda, do you want to start since you do direct care as well in a group?
Yeah.
Okay.
So again, I just bounce right back to that creativity word, because for the population that we serve, we have to realize about the seasons and holiday seasons. And many of these women are separated from family, don't have custody of their children. So that comes, that's something we experience every year in this recovery space. So it's just, again, seeking out opportunities for anything that feels somewhat recreational or connected. And that may mean at one point we were walking in like groups of 10 and spaced out around the mall, like because there were women who wouldn't turn their camera on, for Zoom and just lay in the bed for 3 days. And so finally, okay, so we just want to see your tennis shoes. Like, that's it. That's all we're doing. And if you can't walk at the mall, in your neighborhood, wherever you are, we want to see tennis shoes and shoelaces, and that sounds small. And I also think Ms. Morris mentioned about self-care earlier, like that came up for us as a team member. Everyone that works here at our agency is a woman in long-term recovery. And there had been like this depressed feeling the last 2 days. And I told them, I said, look out the window, like the weather has not been nice for the last couple. So we looked at the forecast and said, okay, sunshine's on the way. So even that is impactful. And we made an agreement that right before all the reports go out at the end of the month, that for the remainder of the year, we will have lunch, together, and we will target in on our self-care and explore. And that's one of the messages that we continue to extend to community, whether they come and paint, whether they get a massage, whatever service they can engage in. We are just continuing to promote that. And we are aware that if we're reaching out to 10 peers a day, starting in October, that may need to increase to 15 peers a day, just because, or increase the amount of contacts. If we talk twice a week, let's throw in an extra day of the week that we are making this communication, because people may become depressed and sink into this dark space due to holiday, due to the seasonal depression, due to their addictions, all the reasons that were already on the table, compounded by the pandemic. And so, surprisingly, it just, little things mean so much, just, I don't know how to describe some of the experiences, but the comments that I hear from the women. So it's not that we need, $10,000 to do this big, huge thing that we're used to doing in December. It can be very incremental, and it can be small. And the more personalized it is, you get a greater response.
I think that is excellent. I would like to, reiterate that it is so important to try to key into feelings and say, you know what, it's okay that I'm feeling sad, or I'm anxious, or I'm afraid, and then try to speak to it, get some support around it. Kind of know, like, what is your threshold? Like, when are things becoming problematic? Because depression is tricky. It can really sneak up on people. And so if you've never really gone through it before, then you may not realize, how the spiral works. Or if you have gone through it before, it can create a lot of anxiety, because people will say, I don't want to get to that place again. And now I don't know what to do around it. So there are professionals that are available to help, and you don't always have to pay for that information, right? You can Google, depression, seasonal affective disorder, am I drinking too much? And you can get so much positive information for free through many, many different sources. And I think Jonathan's going to add, NAMI is a great one, just because you can localize it, you can get collective resources to get support. If you have a primary care doctor, you can have a conversation with that doctor if you trust that doctor. But a lot of people don't have that kind of health care, right? And a lot of people have a kind of a fear about saying, is there something wrong with my mind, so to speak? And so I feel very passionate in general, but even more so during this pandemic, just to destigmatize the need for checking in on your own mental and emotional wellness. I was reading a magazine and they talked about seasonal affective disorder, and there's all these really wonderful gadgets you can buy for light therapy. But you don't have to spend hundreds of dollars on that. If you know that you have a lamp that needs a lighter, brighter light bulb, that might be something inexpensive that you could do, is changing the light bulbs in a certain part of your home to have it mimic more daylight feel. But during daytime hours, get outside. People like to come up with wonderful words, but it makes me think of Dr. Mark when he said he took a walk. And forest bathing is a thing, right? So you can go outside and people are like, what are you doing? Oh, I'm forest bathing, right? I just thought that was funny, but it caught my attention and it let me know I don't have a forest, but I do have a tree in my backyard. So let me go outside and sit for a minute. And what that did was help me stay mindful, get me some fresh air, right? Appreciate that I have a tree. And it made me feel a little bit better. And that is self-care. We don't have to spend a lot of money to take care of ourselves. We can do it in smaller ways too, and it does matter. So I agree with Ms. Shonda for sure.
So I heard Shonda say something that that I wanted to reflect on and reinforce. So the word that I heard that came through was creative. My expertise for this panel is that I'm a population modeler, and I study the dynamics of epidemics. And I can tell you that this epidemic is unprecedented in our lifetimes. The word creative is so important because all of us have occupations, whether you're a teacher or a public servant or a business person or a doctor or a parent or a caregiver. You do something with your life, and that something has been totally upended, right? And how many of us are asking the question, how do I do what I do? How do I live my life in this epidemic? And the answer is, well, nobody can tell you how, because this situation is unprecedented. That's something that I can fully subscribe to, that this is unprecedented. It's a situation that none of us knows how to deal with. And I think that that calls for creativity in figuring out how you're going to live your life for the next day, the next week, the next 3 months, and the next year, probably.
I wanted to just add that I think it's also important to be mindful of the helpers in this season, which we are aware of, essential workers, and especially BIPOC community helpers who are actually working in that community. So the population that we serve, we serve 91.7% white people because that we serve the recovery homes mostly, and the individuals that get that opportunity to go into the recovery homes as opposed to serve their time in prison, it's not a level playing field. However, with my BIPOC friends who are in this work and actually boots on the ground and in, the lower economic level of, the community members, like it's compounded. It is the pandemic, and then it is, the racial injustice, it's all of these things. And we're working more and harder and seeing more devastation, and it is our grandmothers and grandfathers who have passed away. I can list 3 people right now, in my inner circle that have lost grandmother, grandfather, whereas Ms. Moore said, my white constituents, that's not been their story. So with all of this going on, I just think the helpers really, what is the self-care process and the check-in and check on the helpers in community is just really, really important during this time.
Yeah, that's a fantastic point. And I think, your suggestion earlier of reaching out and connecting with others, that's something that I'm really taking away from our talk tonight. We're coming up on about 5 minutes left of our scheduled time. And I'm going to say a few words and then I'll turn it over to each of you to sort of make some closing remarks. But let me first by saying that it really moves my heart that y'all took the time to come out here tonight, come out to Zoom in the comfort of wherever you're at. But it moves my heart a lot because I'm a person who's been following this issue very closely from the earliest days. And I learned a few things tonight. So one of which is just to remember how important it is that we're not through it yet. There's still a lot to learn, and how important it is, like you said, Ms. Shonda, we've got to connect with others. And in the beginning, I really took that to heart in the shelter in place in the spring. But as it's felt like the world has started to try to return to normal in some ways, it's that pull has sort of caused me to forget to reflect on that and reach out to text a loved one or somebody and to take that in consideration. So I take that back to how do we change our behaviors, and we can change some of them immediately, but it's hard to change all of them at once. So it takes time. So being reminded of that importance of community and reaching out and touching others and supporting them as they determine what risk level profile works for them, as they adjust where they're willing to take risk in one area and how they compensate in another. that's really my takeaway from tonight. So again, I'd like to thank all of y'all for being here, and I'll turn it over to you one at a time, and we'll start with you, Dr. Abel.
Well, as John said, we're still on an icy road, and I think we have to, maintain our vigilance. I think we have to double down on it. I don't think we can let up our guard at this point, particularly going into the winter. I remember with H1N1, there was a big surge in the spring, and then cases went down somewhat in the summer, but then it came right back again over the winter. We don't know what's going to happen, but that's certainly a strong possibility that we're going to see increasing cases, particularly as people tire of this. And so, find someone to reach out to, find something positive and that brings you joy every day, if you can, to do, or that brings someone in your life joy. That's all we can do. Thanks again for allowing me to join.
Thank you. Thank you. Ms. Morse, would you like to go next?
Sure, thank you. Well, first of all, Jonathan, I'm so excited that I got a chance to participate, but also to meet you, and I appreciate you. I know it's not political, but to have a candidate, you come across as very sincere and wanting to be for a community, and in a way that is very refreshing. So I wish that I could vote for you, but I cannot. But I will find somebody in Athens who can. I just want to say that it is so important to try to focus on the things that we have instead of what we don't have. Because I think when you focus on the things that you don't have, especially during this unprecedented time, it just leads you down this path of depression and frustration and anger, and it magnifies that. And it's not that those feelings aren't valid, but there are ways to kind of move through them and not get stuck in them. And so, Christmas time or Thanksgiving might look a little bit different, but how could it be still meaningful and valuable to you? And gratitude pops up for me. Like I won't see my mother, she's in Nebraska, but what can I do to be creative so that she doesn't feel like, that she's not with me and I'm not with her? It's not going to go away. It's not going to be like, oh, I love this Zoom Christmas dinner. That's not going to be the same, but it's going to be something that we'll have to figure out. And so I think some of these conversations could actually start happening now. Like, what can we do to prepare for the fact that things are going to be different? And it's okay to ask for help. It's okay to know that you need help. It's okay not to feel perfect. It's okay to feel sad, and that these feelings again can move through, and try not to carry guilt or shame for not feeling like you have it all together, and that you're strong. And strength isn't about not crying or not being afraid or not being depressed. Strength, that to me, is being able to acknowledge that that's what's going on, and then try to figure out ways to get support around it. So that's what I would encourage.
Great. Dr. Drake?
So I would say two things. So the first, to you, Jonathan, thank you for getting us together this evening. I think this forum represents exactly the kinds of conversations that we need to be having in our communities all across America. To the participant tonight, I would say the first lesson is take care of yourself. Take care of yourself so that you can rally with us to defeat this epidemic. And the way we will defeat the epidemic is by reducing transmission. And so keep in mind the things that we've talked about today for ways that you can individually help to reduce transmission. Think about things that you can do, behavioral practices, avoiding certain people or certain places in order to protect yourself. But also keep in mind, as Mark mentioned at the beginning, you can be infected and infect other people without even knowing it. And so keep in mind the possibility of that you might be infecting other people in your family and in your workplace, and take protective measures to prevent that from happening too. But for me, that means always wear a mask when you go outside, or when you're going to work, when you're going to the store. And I do believe that that together, through these behaviors, we can defeat this disease.
Thank you. Ms. Shonda, would you like to wrap up with some words?
Sure. So, as others have said, thank you, Jonathan. It's a pleasure meeting you here tonight. Thank you for the invitation to join the panel. So we have a sign up in one of our rooms, and it kind of leads multiple conversations in our building, and it just simply says, "What's right with you today?" And when women are fresh in recovery and they see that sign, and when they've, lost their kids and facing 5-year prison term if they don't complete this program, they think that there's nothing right, with them, which I think is a similar feeling that the pandemic is having on many in our world right now. It just seems like it's overwhelming, overtaking everything. But really, there's something right that's still going on. We're all here on this panel. None of us are in the ICU at Piedmont Hospital tonight. So if I'm just reminded, we moved that sign, and I'm pointing to it because it's over in that room that we're not in that room a lot. So I'm prompted to bring the sign back into our main room so that we can stay in that mindset of what's right with you today, and just be ever cognizant of that. And another piece of advice or guidance we give women that are new on this journey is the fact that it is a journey, and it's long and at times arduous, and we must be patient with ourselves. And that parallels so close to the pandemic, right now, but it gets better. 14 years later in recovery, my life's better today, but that first year, there were many dark days. So I think, prayerfully a year from now, should we all stay vigilant, as you all have said, we'll have better days a year, from now. So we just must remain vigilant, hopeful, and keep pursuing joy.
Thank you. Thank you so much. I'd like to thank y'all again for coming out, all the folks who took the time to watch. We will have a recording up, and I will reach out to y'all offline for some of the links that you mentioned, and we will make sure to put those in the recording description so folks can find those, as well as in the comments along with the recording on Facebook. So I'd like to thank Dr. Abel, Ms. Morse, Dr. Drake, and Ms. Shonda for being here tonight, taking their time out of their busy lives to share their wisdom with us. And I hope that everybody has a safe and a safe evening, and that the guidance that was shared tonight is helpful to you going forward. Thank you so much.